Hi everybody, thank you so much for joining us for On Call for All Kids. This is a weekly segment we have here at Johns Hopkins All Children's Hospital where we're speaking with our experts about timely topics in pediatric healthcare. And today we are talking about toe walking. Here are your top 3 takeaways. Learning the signs and symptoms of toe walking, what causes toe walking, and when you should see an expert for evaluation. My name is Ashley Roberts, and I'm joined by Dr. Paul Benfanti. He is a pediatric orthopedic surgeon here at Johns Hopkins All Children's. And Dr. Benfanti, what exactly is toe walking?
Well, just like the name implies, it's when the child spends most of his time walking on his toes or on the balls of his feet. We consider this normal up until about the age of 2, and after that most kids will get over it and start to walk with a normal gait after that.
So it could be normal if by the time they start walking to about the age of 2 they're doing this. That maybe wouldn't be something of concern to you.
That's right. So if I have a patient who comes in and they're under 2, I'll tell the parents this is normal. We'll just continue to observe. If they're older than 2, we will start to then look into potential reasons why they may be a toe walker. And so things like that would include, well, we would start with a history and physical. So the history would include things that would determine if there's any kind of neurologic reason they would walk on their toes. So conditions include things like cerebral palsy, myelomeningocele, autism, things like that. And so the birth history goes into, well, were they a full-term baby? Were they preterm? Did they spend any time in the unit? What were their developmental milestones? When did they crawl? When did they sit? When did they walk? And is there any family history of toe walking? Many times you'll ask about the family history, and half the child's relatives toe walked, and they eventually outgrew it. So those are the first clues we use to determine if there might be an underlying cause or etiology. So most kids, however, are what we call idiopathic. So idiopathic is just a term we use that says we don't know why they walk on their toes. They're normal otherwise. It's just the way they were programmed to walk. One of the other terms you might be familiar with is habitual toe walking. That's another term for idiopathic. So most of the kids we see are idiopathic toe walkers, meaning they're normal kids, they just prefer to walk on their toes. So
if we're at home, what are these signs and symptoms? Literally just walking on their toes. What should we look out for as a parent?
So as a parent, like I said, up until age 2, don't worry about it. After that, still don't worry about it, but maybe start to think in the back of your mind, is your child spending most of his time on his toes? If it's just when they get excited or they're running, that's okay. But if they're spending the majority of time on their toes, and they're getting to the ages of, they're starting kindergarten, maybe start to think of having them looked at.
So what's the first step with that too? Is this something they would want to maybe bring up to their general pediatrician first to get a referral to you? Or how does that often work to get that a first appointment with you?
The parents can do either one. So a lot of it depends on their insurance. So a lot of times they need a referral from their pediatrician, and the pediatrician's fine to start with. This is normal pediatric stuff. Or they're more than welcome to come and see us right off the bat.
So if they come here, it's a diagnosis, maybe they're past the age of 2, what do treatment plans look like from there? How do you handle these cases?
Yeah, so the treatment depends on several factors. One is there an underlying etiology? So if the child has cerebral palsy or autism or sensory disorder, then we can help with that, but we may not ever be able to stop them from walking on their toes. They might just be permanent toe walkers. If they're idiopathic, meaning they're otherwise normal, then there are things we can usually do to help. And then those children are kind of divided into 2 big groups. The first group is the kids that walk on their toes that still have normal motion. They have great motion of their ankles. They can walk heel toe if they want to. That's one group. The second group is the kids who are contracted, meaning they have very tight heel cords. They couldn't get their heel down if they wanted to, so they can't walk on their toes. So depending on which group they fall in determines the treatment. So starting with the first group that are very flexible, it really is their programming. So we have to reprogram them to walk heel toe. And in my experience, at least, the best thing to do is to put them in what's called AFOs, or ankle foot orthoses, which are braces, which force them to walk heel toe and will not let them come up on their toes. And if they wear these for about 6 months, then they usually break the habit. The second part is if they're stiff, we have to regain the motion. Okay, so that can include serial stretch casting or potentially surgery if they're really stuck, and then they go into the braces.
Okay, well, this is really good information. So you're saying pretty much from the time they walk till 2, probably not a concern. If there is extra concern, maybe you think there's an underlying condition, surely they can be seen.
Correct.
And otherwise, try not to worry too much until we're past age 2, right?
Right, perfect.
Okay. Dr. Benfanti, thank you so much. If you have a topic you would like us to cover, you can comment below on this video. We thank you so much for tuning in. You can also check out our website. It's hopkinsallchildrens.org/newsroom. Lots of information and articles there as well. We will see you next week.